This is the University of Sheffield Health Service podcast on maternal health. This podcast is prepared for the students and their dependents registered with our practice to help them with information about pregnancy and childbirth in the United Kingdom. We will cover this in 3 stages: planning to conceive, pregnancy, and childbirth. If you're planning to become pregnant, start taking folic acid tablets daily. They can be purchased over the counter in all the pharmacies. The usual dose is 400 micrograms every day until 12 weeks of pregnancy. Smoking and alcohol are harmful to the baby. This also includes passive smoking. If you need any help stopping smoking or alcohol, please see our relevant podcast by clicking on the following links. Eat a healthy and well-balanced diet with plenty of fruits and vegetables. Try to include foods rich in iron, calcium, and folic acid. These are some of the examples of the foods you should try and avoid if you're pregnant or planning to conceive. Foods with high levels of vitamin A, like liver products, undercooked meat or eggs, soft cheese like brie, unpasteurized milk, fish containing high mercury levels, and excess caffeine. Please see one of the doctors at the University Health Service for specific advice if you suffer from any medical problems, particularly diabetes or epilepsy. You can purchase pregnancy testing kits from most of the pharmacies. Make an appointment to see a doctor as soon as possible if you're pregnant. If you're having problems becoming pregnant, see a doctor for advice on whether you need any further investigations. If you have recently found out that you're pregnant, congratulations. Make an appointment to see one of the doctors at the University Health Service if you're already registered with us. For information on who can register with us and how to register, please click the following links for our podcast. After the consultation with the doctor, you'll be referred to see a midwife. A midwife is a health professional who looks after women throughout their pregnancy, during childbirth, and for about 6 weeks after childbirth. You will be given information about how to arrange an appointment with the midwife. Please make sure you contact them promptly because your midwife will refer you for some blood tests and ultrasound scans. There are 2 types of scans: dating scan and anomaly scan. Your midwife can advise you about the scans and blood tests. You will have regular appointments with your midwife. At each visit, they will check your blood pressure, urine sample, and listen to your baby. If you develop any complications or problems during your pregnancy, your midwife will arrange you to see one of the doctors at the University Health Service or one of the doctors at the hospital as appropriate. So, what are antenatal classes? Antenatal classes are a place where pregnant women meet regularly. They are usually conducted by the midwives, and it's a place where you can get valuable information about your delivery process, that is, different stages of labor, pain relief options, place of delivery, breastfeeding, and how to look after your baby in the first few days. Try to attend the antenatal classes with your birth partner. A birth partner is someone who you think will be with you at the time of delivery. It can be your partner, friend, or relative. In Sheffield, you will also be given an opportunity to visit the maternity hospital. Antenatal classes cover some important information like what sort of things you'll need to take to the hospital. These classes are particularly helpful to the international students and their families as they help you to understand the maternity services in the United Kingdom better and relieve any anxieties related to your care. You can also discuss with your midwife about accessing various support groups for pregnant women, exercises, yoga, and other relaxation techniques. Ask your midwife for advice about what foods to eat and what to avoid. If you notice any unusual vaginal bleeding or abdominal pains during your pregnancy, Seek advice from your midwife or one of the doctors at the University Health Service promptly. You can contact us at the University Health Service by ringing 0114 2222 100, or you can also ring NHS Direct for advice on 0845 4647. If you are over 20 weeks pregnant, you can also directly ring the maternity hospital for advice. Please contact your midwife for further details. You are eligible for free prescriptions in the United Kingdom if you are pregnant. Ask your GP or midwife for a prescription exemption form. For more information about your pregnancy, childbirth, and your rights, see the following link for Pregnancy Book. You can also access the Pregnancy Book 2009 by typing it in any internet search engine and following the Department of Health link. You can choose to give birth at home or in the hospital. Your midwife will advise you about how to recognize the signs of labor, pain relief, and when to come to the hospital. Your birth partner can stay with you during labor. If you have a normal delivery and the baby is well, you are usually discharged home in 24 hours. You may have to stay longer in the hospital for other methods of delivery like the cesarean section, or if your baby has any medical or feeding problems needing further period of observation. There are specific times for visiting on the postnatal wards. Even the birth partners are not usually allowed to stay during the night in the hospital. Staff on the wards will help you look after the baby and yourselves while on the ward. At the time of discharge from the hospital, you'll be advised about the follow-up arrangements, immunizations for the baby, when and how to seek help if you have any problems. Please see our podcast for new mums and families for more information about care after childbirth. These are some of the many useful resources for information about pregnancy and childbirth. The Pregnancy Book 2009 and Birth to 5 can be downloaded by following the links here or by just typing the Pregnancy Book 2009 or Birth to 5 on most of the internet search engines and following the Department of Health links. Antenatal Results and Choices is a voluntary website which gives information about various antenatal blood tests and scans. Birth Preparation Classes gives you information about the local antenatal and other classes available. You can now access all our podcasts using the YouTube channel and get regular updates about the University Health Service on Twitter.